Welcome to MasterMined, the behavioral health business podcast. We go beyond the clinical to explore what it really takes to build, grow, and lead a successful behavioral health organization. Each episode features candid, practical conversations with industry leaders, offering strategies to scale your business while staying true to your mission. From branding and marketing to leadership, culture, and compliance, we cover the tools you need to balance care and commerce with confidence. MasterMined is brought to you by Snapshot, a digital agency on a mission to serve with heart, execute with excellence, and build something bigger together. And now, welcome to MasterMined.
Welcome back to another episode of MasterMined, where we are rethinking behavioral health. Last episode, we discussed the importance of transparency with your agency and what common mistakes we see. This week, we'll be touching on another common thing we see: misinterpreting the numbers and lacking a clear strategy. Marketing is just one piece of the puzzle. Without further ado, I wanted to introduce my fabulous co-host, Lee Pepper and Jeff Skillen. Thank you for being a part of this show. And we'll just jump right into it. We'll get into the data and the numbers. What do you all see as a common mistake or common opportunity that behavioral health programs have with looking at the numbers and the metrics?
I'll take it, Jeff.
Yeah.
I think from my perspective, it's taking KPIs that were handed to you from somebody else or from another department. And I think that's one of the innovations that we brought to foundations early on, was that we had the financial KPIs that were important, but we started to develop our own marketing KPIs that we ran in parallel. And then we were able to connect those KPIs to what the CFO wanted to see. And that's really what allowed us to start making really solid decisions on our marketing mix and our marketing spend. Just because you've been handed census data, or just because you've been handed your cost per admit or your cost per lead, that is something that another department may be important for them, or for maybe your investors or for maybe compliance purposes. But just because they're doing it doesn't mean that's what you need to make good decisions from. So centers have to create their own KPIs. They can't just dissuade what's important from other departments. They need to run them in parallel. But they have a lot of power, and they need to understand that they do have the power to create their own metrics if that's what they're going to use to drive important decisions on their marketing spend.
Great point, Lee. Jeff, do you have anything to add to that?
Yeah, I think I would like to remind everybody, KPI, key performance indicators. When it comes to marketing, we understand the KPIs that are involved in running a successful program. We do, like to Lee's point. When we're looking at it from a marketing perspective, these things are so much further upstream from those indicators. So yes, they need to be run in parallel, but we also need to recognize the sequence of where these things happen, right? Because by the time you get to a census number, that is a lagging indicator from the marketing activity that you've already previously sown into the marketplace, right? So it's like from a marketing perspective, we need to be thinking constantly about, we are a leading indicator as opposed to census being a lagging indicator. And unfortunately, when people feel like they need to move the needle on census, they're already behind. Mm-hmm. So, the key performance indicators that we look at from a marketing perspective, they need to be tailored specifically to your organization and to your objectives. And I'm sure we're going to get a lot more deeply into them, but they need to be specific to you and what you're trying to accomplish.
Yeah, let's just keep going down that path, Jeff, and maybe just tell us, with your clients, what metrics do you see that matter the most, that are really truly driving the needle for some of these programs?
Well, I would make a differentiation between what they think drives the program or what they
Good
think
point.
drives the needle versus what actually does drive the needle. Because, we're all victim to the social media algorithm. Whether we like it or not, we all have been guilty of scrolling, and we think that that's actually being productive. So what a lot of programs start with is like, wow, we're just doing nothing on social media. Wow, I mean, if we were just more active on social media, our phones would be lighting up. When we all know, as professionals in the space, that is so top of the funnel that that is barely a drive-by consumer in terms of someone who has any real intent. So we need to be thinking about if what you need is actionable form fills, phone calls, or people that are actually seeking treatment, we need to get way deeper into the funnel to where those, where the decisions are being made, and that's going to be closer to content that's relevant to what they're looking for, or an advertising campaign or a media campaign that is literally right in their ears, like a podcast, for example, where you're speaking almost one-to-one with someone who's about to make a decision.
Mm-hmm. Lee?
Mark, I think that a lot of times when I'm meeting with owner-founders or with CEOs or executive directors, a lot of what their frustration they're describing to me is trying to create demand. And that is not really what we do. We capture demand. The demand for treatment services is already there. I don't need to create any more demand. There's already 23 million Americans that need our services and aren't getting it. I don't need to create any more. But what I do need to do is capture that demand. And as I'm explaining that, you can start to see the light bulb go off in their heads, because now they see that they have some what I call cognitive bias, because they're experts in their area and they think that somehow gives them insight into the marketing. And it really doesn't. They don't know what they don't know. And so I think it's when they work with somebody like Jeff Robb, we start to kind of peel that onion back for them. And then once they understand that, now we can start figuring out what are these KPIs that are really driving your business. So as an example of everybody's got FOMO with social. It's great that you've got all these likes and comments on your social, but is that really what's driving your business? And for a lot of people, it's not. Now there are ways to budget friendly be active on all those type of platforms while you're still investing in capturing that demand. And I'm sure Jeff and I will speak more on that. But I think that difference in creating demand versus capturing demand is kind of fundamental to what we do.
Yeah, guys, what I'm picking up on is this is not a hobby for you guys. Like this is, you're bringing some real value here.
That is a great quote,
appreciate it. What I just heard is that a lot of times people view marketing almost as a tool instead of like putting together the map for where you need to go with KPIs and what are the meaningful things that are really driving the business. And so, just thinking about like leaning into that, like what are the metrics that you guys work with your clients on? Like what are you seeing? Where have you been able to really move the needle with some of these things? And what have been some of the tactics that you've done that have really moved that needle?
Well, I think one of the first things, in order to capture a picture, first of all, do you actually have the systems to capture your data? I mean, let's just start from the basics, right? Do you know where your phone calls are coming from? Do you know where your form fills are coming from? And do you actually have a system that can present this to you in a way that's meaningful? So for example, I mean, one of the first things that I hear from people, you'd be surprised how many people can't tell you how many phone calls a day, a week, a month they're currently getting. And okay, that's where they're starting. Great. Let's just start with where they are. Once you start to be able to show them the information of how many phone calls, then we want to talk about what's the marketing stimulus that's generating that phone call, and then get those into channels so that you can figure out which channels are effective, which channels are not effective, and which ones require investment and which ones could actually be left fallow, if you will. And so a lot of times it's like that level of granularity, although it's very simple to do, a lot of programs really have not even done that basic work in terms of having a system to then look at these channels and see what's effective.
Lee, do you want to build on that?
I think, Jeff's earlier comment about, like as an example, census being a lagging indicator is really critical to understanding this concept, because when people will engage with me, and then I'll get text messages or emails about census. We've got a dip. Well, that census dip was actually something that started weeks ago and probably months ago. And so what I try to walk folks through is that you need to create your KPIs and understand that before you can have an admission, right, you need to have, for some examples, a VOB, or for other companies it might be an assessment. And before you can have that VOB or an assessment, you need to have a lead, a qualified lead that's put into your CRM. And before you can have a qualified lead, you're going to then branch off to either having some type of meaningful activity from a business development person, or you're going to need to have a meaningful activity from an alumni group, or you're going to need to have some type of meaningful activity on your website. And then you go deeper. And as you start tracking each of those, now all of a sudden this lagging indicator can now become a forecasting tool. Because once we have programs where I can see, as an example, organic visits to your website, if we can start seeing that grow, we know exactly how many leads that traffic generates and how those leads then generate assessments and then eventually VOBs and admissions. And they all have different conversion rates. And that's important to understand. A lot of times, as an example with your finance team, they want to have what's your one conversion rate? Okay, that's fine for what they're doing. It's not helpful for what marketing's doing. Marketing needs to understand, like, the conversion rate on leads and calls from a business development situation is going to be a lot more advantageous and favorable than from an organic situation. And then paid search, that's going to be even different from your organic. And if you don't understand that, you will start applying some decisions in the real time, in the reactive phase, that could really impact you many weeks, down the path.
Yeah.
Yeah. Each one of the, as Lee points out, and each one of those conversion points is a data point and could be a KPI within your marketing funnel. And that's probably too much information for other people in the organization. The financial side, or even, it's important. I think the C-level people understand all of those conversion points, but to Lee's point, it's like you will determine the quality of that lead based upon the channel, and then you need to speak to some experts to give you a range of what is an acceptable percentage. And if you're below an acceptable range, there are things that you can do to then, for example, on paid search or organic or whatever, to make sure that those phone calls or those leads that you're getting, it's like if you're outside of the range, there's some things that you can do to get you into the green. Right. But if you don't know what's acceptable and what's not acceptable, you'll be making decisions in the macro, like Lee indicated, that may or may not actually help you. So this is, data is about fine tuning on the micro side.
Yeah, man, I just love this. And I guess, with all this insight that you guys are sharing, I want to take a second and just remind the audience that if you have any questions, please drop them in the comments so that Lee and Jeff can respond to that, or we can actually create a whole episode based on maybe a challenge you might be facing. And so I just didn't want to leave this without making sure that was out there.
Yeah.
And, well, just as we and you all put together plans and you execute against a campaign, and that campaign then drives, people into, the centers, whether it be a form fill, whether it be a phone call, and these are people that really need something right away. Sometimes we hear about census down, call volumes down, and then we look at it on the back end and we look at the data and we see that, instead of maybe 10% of the phone calls go unanswered, it might be 20%. And something happened, or these form fills aren't getting responded to in a timely manner. Maybe instead of, within 30 minutes, maybe it's, within 24 hours. And by then, they're probably on to somebody else. And so maybe, I don't know, do you all see that with some of the clients you work with?
Mark, it's every week. If you get a phone call and somebody's telling me that, our assessments are down or our admits are down, and then you have to ask the question and look at what's going on. Oh, okay, well, we had 2 folks that were out on PTO. Okay, well, if we don't understand that, all of a sudden we could make very poor decisions. We could decide, without knowing that, maybe I need to go ahead and move some chips over to paid search, which is going to be a more expensive lead gen. We can do it, but not understanding that can cause, I think, and then once you do that, now all of a sudden you've messed up your strategy. And that's where it's so critical to understand. There's a lot of levers that we can pull. But if you start to make decisions without understanding the full picture, you're going to all of a sudden upset the strategy and kind of what you've been building. And so I see that all the time where, we used to be famous saying that our marketing spend would be 10% of our net revenue. That's how we kind of built our marketing budget. And a lot of times we were, especially with outpatient clinics, we're kind of famous for this. We would move into a new territory. Well, nobody knows us. We got to do branding. Okay, well, I'm not a huge fan of branding, but there is a part of it, but it has to be paid for. It has to be tracked. And so because it doesn't have a great ROI, but you still do it as long as it's within your 10%. And it's not going to have a conversion impact directly on its own, but it is going to potentially have some positive impact on some of these other channels. As long as you're tracking and understand that, then that's fine. But I'm willing to do all sorts of tests, but we have to track it. And then if we know if it works, great, we'll move more into that. But if it doesn't work, it's okay. It's no harm, no foul. We just know we don't do that again. But so many places will do things, they don't track it, and then they wonder, did it work, did it not work? That's the real fundamental flaw.
Yeah, I think it's important that we further illuminate or illustrate what Lee has just pointed out. And I'm going to try to frame it up a little. Lee just gave us a great formula to indicate what a marketing spend should be. It should be tied to net revenue. Some programs will tie it to gross revenue. Find out what a number is. Here's the connection that I'd like to make. You need to think about your marketing spend like a portfolio, right? And so it's like, from a portfolio standpoint, just because you get a little turbulence in a portfolio, it doesn't mean you change everything, right? And I mean, you need to be smart about the way you set up your portfolio. Yeah. And then if you believe in your portfolio, then you actually go through some turbulence and see what happens. But meanwhile, you've got some data to actually make some informed decisions, right? So if you look at what's actually, what can someone listening to this podcast do and be actionable? The first question is, how do you determine your marketing budget? Do you actually have a number or a metric that you've used to determine what that is? If you have, great. Now, what does your portfolio look like, and how are you dividing that up amongst the channels that you have? Business development, digital marketing, alumni, the admissions team, and then training for all of those people. So it's like all of that should fit within your marketing budget. And then if you need help in terms of setting up what that portfolio should look like and how well your portfolio is performing, that's really when it helps to reach out to an expert, because it's really easy to be, in the middle of the storm, not really understand what's happening. Sometimes it helps in a storm to talk to a weatherman.
And Jeff, how many times have you gone into a program and asked for the marketing budget? Oh, I don't have it, or I got to get it from the CFO. I mean, I'm always really amazed at how tight some organizations are. Meanwhile, you've got your marketing team that is out there, your public face, spending 10% of your potential net revenue, and they don't even know kind of what the budget is or should be or what they're tracking to. I'm always astounded.
Well, and the other thing too to keep in mind is, like, if you're starting a program right now, that number is going to be bigger. Because you're speaking, 10% of net revenue. That makes sense for a going concern. That makes sense for a program that's already in operation and you've got some track record. If you're trying to start something, you've got to prime that pump. I mean, there's a lot of energy to then get that out there. So it may start at a higher number and work your way down. Again, you need somebody who's been there, who knows how to guide you.
When we opened up Black Bear Lodge in Helen, Georgia, many years ago, we didn't just launch the website on opening day, right? We had to launch the website 6 months prior just so we could start generating SEO. It had to build over time. But yet a lot of companies want to wait. Well, we can't take patients yet, so why do that? Well, meanwhile, you've had to order the beds, right? Like, you've had to order the nursing station, right? You've had to put in the IT infrastructure, right? Like, they don't think about it. They'll do all the capital stuff, but like, oh, I can't spend dollars on marketing. No, it's got to be part of the your upfront build costs. You've got to allocate for that.
Right. I mean, marketing is, I'm just going to stick with the storm analogy just because I like
love
it. And there's tornadoes coming through Middle Tennessee this week. Anyway, couldn't help it. It's like, but a lot of people think that marketing is like lightning. I mean, that it can just come and in a flash, boom, you've got something. And it is way earlier than that.
I've got a quote that I've got to throw in, Jeff. Okay. So Noah Ben Shia, who I've worked with for many, many years, he has a quote that I included in my new book, that some leaders will put their head in the sand and claim they're in a sandstorm. And when he said that to me, I was like, Noah, that is gold. Because it is true. We'll get these phone calls. The sky is falling. Oh, my gosh, I'm under all this pressure. Meanwhile, I'll ask them, well, are you tracking your data? No. Well, how do you know you're really in a sandstorm? And if you are,
census is down.
Right, yeah. And it's because it's kind of maybe self-inflicted.
Yeah. What's interesting about this conversation, I love the portfolio of like what all you can go do and managing your portfolio. And, we're all small business owners. We're all business owners. And we think about our client's business as our own, and I think that's one thing that may separate us all from other folks out there. And with that, if I take an opposite approach and I say, maybe they do have their budget figured out. Maybe they are spending, but they just keep spending on things that aren't working, and I think that's where we've seen, like, why are you spending that amount of money on this tactic when it's clearly not working? Why don't you diversify and spread it across the rest of the portfolio that is starting to move the needle? And I think that comes with the transparency and with the KPIs that you guys have talked about, and like, let's measure this, and let's not go a year of spending this amount of money when it's clearly like could be allocated better in other places.
Well, I agree with that completely. I will say before you make a shift like that, you need to do some intelligent diagnostics about why it's not working, because oftentimes those decisions are made at a very high level as opposed to, well, is our admissions team really trained to take that specific call or that specific lead? And maybe it's possible that that marketing channel is actually very effective, but you haven't educated your admissions team in terms of this is the kind of call you're going to receive, and here's why you're going to receive it, and here's how you need to handle it. Because I'd like to point out that, as much as we're talking about data and as much as we're talking about KPIs, super critical, but we all need to realize that that data represents people. And at the end of the day, we are helping a person make a decision. And we are helping a person go from where they are currently to a better situation. So the diagnostic that I'm referring to is great. We've gotten their interest, but are we ready to actually engage with that person at a human level and convert that person to wanting a better life and then wanting to take a step to move in that direction? So if we don't have those systems in place and we're not actually prepared to, so you might make a marketing decision at a high level that doesn't go through that process and is like, how many times do you actually call and secret shop your own program? How, it's like, have you called other programs to see how you're treated as a human being? It is very illuminating to see what that human experience is as opposed to looking just at a data KPI or dashboard.
Yeah, and I know we're just talking about some of the marketing tactics, but what I appreciate about you guys is that you both like scale across the programs. And it's not just, a ton about marketing, probably more than most people will ever know. But you also lean into the call centers and the training that's involved and the sales teams and what activities they're doing that's moving the needle. And just leaning into that call center. I'm sure you see, and we've seen in the past that, some calls are almost like robotic. They're almost like, and instead of them viewing this person as a client in need, a client that's got a desperate need, they've got a question, they need to be handled with kit gloves, it's more of like, what insurance are you on? What is your problem right now? And I know we've talked about training and how you both lean into that. Maybe if you guys could talk into that, maybe what you're seeing from that aspect.
I think when it comes to Admissions Center, most companies that I have worked either for or with, there's a lack of there's no feedback mechanism.
Okay.
And so you have an Admissions Center silo. And so what happens is we don't train our admissions team for the most part. And when you think about your clinical team, our clinical teams are highly trained. For the most part, your IT department is highly trained. Your nursing staff is highly trained. But for some reason, when we get over here to the admissions side, we're either unprepared as to what that training would be, And so I always like to approach it that we have to have that feedback loop. So we have to have a team that's willing to be coached, which means they have to be willing to have their calls listened to, and we have to lean in. It's a safe zone. There's no judgment here. We're just trying to say there's an opportunity here for us to lean into you, provide some training. And a lot of that training is no different than what your clinical team would get. Without naming too many names, one of my favorite people is Nick Hayes over at Cumberland Heights. And Nick was telling me as we were setting up kind of their internal training that when he was going through his clinical practicum, like he would sit there with a client and his supervisor was on the other room with a two-way mirror watching what Nick was saying to the client. And it wasn't from a judgment. It was just, hey, here's some tips. Here's what I would have done. But for some reason, when it comes to admissions, a lot of times, a lot of programs are afraid to kind of lean into that. And I find that most centers that I work with, the people are craving that kind of information. They're craving motivational interviewing training. They're craving a book club because they want to do better. I mean, they are getting the calls. They want to know how to service the different clients better. And we have to budget for that, and we have to lean in and provide that training and not be afraid and approach it from a perspective of no judgment. We know we can all do better.
Yeah, I agree with what Lee said, and I would also add that oftentimes, just staying with the admissions teams, for example, oftentimes they're not even aware of the marketing campaigns that are being run. And so it's really important to educate them and actually bring them into the process and say, this is the marketing plan, and this is what we're doing to generate demand. And when that phone rings or when you get that form fill or you get that chat, here's the messaging that is out there, and you should be able to grab that messaging and then take it and run with it, right? It's amazing how illuminating it is when they understand why they're getting the call they're getting, right? And then to your point, Mark, the programs that really thrive in this area, they don't view each of those phone calls as a transaction. It's an opportunity for them to look at that person as a transformation. So it's an opportunity to then transform where that person is, educate them about what we have to offer, and then move them along into a better situation for themselves.
Yeah.
Jeff, I love that. I think that when you go in, and a lot of times centers, when I'm on their site the first day, I'll hear from the call center, well, people are calling in and they don't even know who we are.
Right.
Okay, that's where it's an opportunity for us to engage with them and say,
Totally.
hey, this is a great example of we're capturing demand.
Right.
We want to be there. We want to take this opportunity to introduce ourselves. This is why you're getting phone calls and people aren't aware of who you are, because a lot of times they may have started based on just relationships they had in the community. And now they've kind of exploded, and now they're being seen by these other folks that we're now capturing the demand. And if they don't, once the light bulb goes off, now they see like, oh, okay, this is not just some spammy marketing thing. No, this is like intentional. And that, oh, wow, I'm part of this whole demand capture opportunity. And I think you're totally right. I think it changes that narrative. They feel empowered now,
right,
instead of just kind of being treated like off to the side. Because if they're not getting training and they see everybody else getting training, they will start to do that. And I did want to share one quick story. The way that I first got introduced, right, to listening to phone calls was back when I was a young butter bar second lieutenant at Fort Knox, right? This is in 1992. And I'm in armor school. And the first couple of weeks we're there, they had video cameras set up. And they were recording us standing there giving the orders of the day. And that was so enlightening for me when I saw myself, and you got your hands in your pocket and you're hemming and hawing, and you don't really have that, you're not commanding respect. And when you're standing in front of your platoon or your company and you've got grizzled old staff sergeants who were in Vietnam, do they really have a lot of respect for you? If you're not really, on point. And so that was so important for us. And the Army knew it was practice, right? It was that repetitive practice that really gave us the skills. And that's sometimes what we fail our admissions team, is getting them that repetitive practice and really investing and leaning into them.
Well, I'll take it one step further. And I realize that we started talking about data, but I just can't let this go by. I can't touch butter bar, okay? So I'll just leave it at that. But I will say along those lines, a lot of times, I mean, one of the things that I love in terms of training and working with people, it's a little intimidating, but just roll with this, is like I use video. I video people and watching their performance. And give them an opportunity to see themselves in that mode. So it's like, of course, admissions people listening to their own phone calls and getting comfortable being uncomfortable, listening to what their voice sounds like and how they engage. But it's like how would any athlete improve if they don't have game film to look at? I mean, if you just
That's so true.
if you just stayed in the realm of the hypothetical with an athlete, for example. Yeah, they might improve a little, but if you could show them the video of them in action and they could see, well, if you just position your body differently, or if you approach this from this perspective, do you see the difference that would make? That's very similar to what Lee's referring to in the military training, is that, yes, it's repetition, but it's also meaningful feedback and taking that extra step of like showing someone in action, and then they can self-correct themselves.
I was with a client, and they were a famous program that does a lot with EMDR. And I challenge anybody listening to this that offers EMDR, have you actually heard a live recording of how your staff describes EMDR?
Wow.
They need to go do that.
Yeah.
We wrote a whole training session on that, because when we started listening to the calls, we were getting all sorts of stuff.
Yeah.
If you had been through EMDR, you had a little bit better handle on describing it for a patient. But we heard everything. I mean, clicking and and it wasn't really resonating. And so I challenge anybody we know you got good people, but have you given them the tools, right? Because they may not be great speakers. They may not be naturally gifted at speaking about certain things, whether it's equine or DBT or CBT or EMD. There's all these different programs that we take for granted. Oh, well, we do it. I've been through it maybe. But are you really good at describing it and locking in with that person on the phone? Because your marketing team, whether it's BD or digital or alumni, they're delivering the opportunity. They've captured that demand. Now, what are we doing to showcase that they have reached the right place, that they have found the right program that's going to execute on that?
Right. I guess one way to think about it is, that admissions team, and we're focusing a lot on admissions, but I think it's critical because they tend to come last in the equation a lot of times.
You're so right.
They're really the front door to your program, right? And so think about it as though, all of the marketing efforts go out into the wild to then capture the demand, like Lee's referring to, and then bring it to the front porch. Well, if that front porch is not communicating what you have to offer and then being honest and truthful and then actually offering a real service, then all of that work that you've just done is lost into the ether. And what a missed opportunity. So then, Mark, back to what you originally said, you're going to make a financial decision based upon whether a channel is performing or not, when it may just be a matter of your front porch is not actually communicating on the field work that's being done. And so I would hate to make a move in my portfolio if I haven't followed the thread all the way through.
You guys, great points. And one thing I'm picking up on is every time I talk to either one of you all, I learn something new. And it is like beyond just the, healthcare, behavioral health, Lee, you with Fort Knox. Did you ever get to see the gold? Did you get to see it, or can you talk about it? Did they let you inside, or was all of that just outside?
Growing up as a James Bond kid, I was so hopeful that we would get a tour, and we never did. And what's funny is, they've moved the armor school from Fort Knox now down to Fort Benning. So they don't even train armor officers. So I'm probably one of the last ones that went through there. But
yeah, I love how Lee can talk about the Army. It's like, and I just think about my proving ground was just practice rooms and tour buses and things like that. But it's remarkable how it is so similar. It's just like you either learn the skills early or you don't. Experience is the truest teacher in that.
Well, as we continue this journey together, I'm just excited that more and more of these things are going to come out that I didn't even know about you guys. So, but getting back to the show and the episode, as we're starting to wrap up, what do you see as being the best conversion, or is it calls, is it chats, is it form fills, Where do you see your clients leaning in?
Well, what what I would like to take a half step back. I wanted to talk about the great technology that's out there around your phone calls and your form fills. I'm a big fan of CallRail. I've got clients that work with CallRail. I've got clients that work with CTM, call tracking metrics, and clients that work with Invoca. So I have to kind of be agnostic in a sense, but I love CallRail. But the great thing is there's so much data in there, and I find a lot of programs they'll get CallRail, they'll get CTM, they'll get Invoca, and they stop there.
Yeah.
Meanwhile, there's all sorts of amazing stuff within there that can really give you data, give you information. I use that type of technology to help inform what kind of content that I recommend that our clients produce.
Yep.
Because I can see from the transcript how many people are calling you about equine or how many people are calling you with fentanyl. I don't have to guess.
Yeah.
I've got the actual data that I can now say, this is why we're writing content around buprenorphine. I don't have to make it up as an example. It's in the data, whereas most of the time, people are guessing. Maybe it's an educated guess at best. And you don't have to do that anymore. Then you get to your conversion metrics. They're all going to be, I think, different. I would hate for somebody to listen and say, well, Lee Pepper said you got to go form fills. Or Lee Pepper says you got. It's really determinate on your specific program.
Right.
So I would leave them with, you have to demand from your team and your agency that what are the best, and then you lean into that. Because you can't just copy what the program down the street's doing. Or you can't just say, oh, I went to West Coast and I heard somebody say this.
Right.
No, you will know better. You have the data. That's what's so amazing is all these programs, they have it. They have the data. It's just a question of mining it.
Yeah, I'll take one step further, and I agree with that. And Lee's speaking specifically to some of the tools in the marketing funnel. There's data deeper within programs that they may not even realize they can use to inform marketing. Perfect example. Look at your assessments that you're doing, right? When you look at the assessments, you will know what people are reporting. And not only that, you will know who's on their care team, and you will know additional referral sources that come up in those assessments. They'll be like, I work with Dr. So-and-so, and chances are you may or may not already have a relationship with Dr. So-and-so. And so as you're collecting that data and as you're getting information from clinical notes and things like that, that can inform marketing decisions, because those are warm leads that you've already generated, but chances are the marketing team doesn't have access to it, or you're not integrating that back into your campaigns. So all of those tools are available, but I think you need to be curious and you need to be inquisitive and know that you've already got a lot of data. It's not aggregated, it's not synchronized, and it needs to fit within your overall marketing portfolio.
I had a client last year when we were doing an analysis of their website, and I provided for them, here's what your drop-down nav says that you guys are specialized in. This is what you're telling Google and the world that you do well. One of them was heroin. I was surprised. I said, "Are you seeing a lot of heroin clients?" I mean, it's fine if you are. That's great. But I had not. I had been there for a couple months. I had not seen one. Oh yeah, we really rarely see that. But yet it's in your drop down. It's in your nav. You're telling the world. You're telling Google that this is our ideal client. And they were like, "Well, that's just what the agency said we had to do for SEO." And I'm like, now you've created a problem. If you do get those calls for heroin, your team is really not qualified or set up to take those calls. Now you've introduced an inconsistent lead, which makes it hard. And that's where you've got to, like Jeff said, you've got to lean into the data. You've got it. You don't have to make it up. You don't have to guess at it. You actually, and then when you deliver a call that's based on data that you're seeing like in Sunwave or in Keepoo, wow, that is so powerful now. Because now I'm getting the kind of clients that we actually can work with successfully instead of getting some random client. And that's where I hear all these problems with the milieu or the acuity level. It's caused by some disconnect in your marketing, your business development, your alumni. That's where it starts from.
Yeah, great point, Lee. I think, you mentioned a couple tools, and, with just the call rail or call metrics or any of the call systems, I mean, and I know AI is a big buzz right now, and it's really changing the way business is done. Even so much so that a lot of those call systems are AI is able to analyze all the calls and actually identify challenges with certain people, or what are those opportunities that we ought to be going after based on the call volume that we're getting around a certain subject. So, I know we're going to talk about these things on future episodes, so I don't want to go too deep into it, but maybe just as we get into the lightning round, maybe what are some of those common tools, and maybe even if you guys could speak into budgeting, or what is the number, or a range of numbers that maybe programs should consider investing in their marketing operations. So maybe let's start out with maybe some common tools that you guys see in this business that in future episodes we can kind of break down the tool sets, but maybe what are some of the common ones you guys are seeing that are really moving the needle for some of these programs?
Well, I'll jump right into the lightning round, and I'll feed right. To me, the lightning round here is with, you need to create your budget. Don't just take the budget you've been given. You need to create it. Now, your finance and accounting team, they're going to have a budget, but you need to create one,
right?
So that you know exactly what your strategy is leaning into, and you can make it. You can work with your CFO, with your accounting department to make sure everything lines up, but you need to create that. Don't wait for somebody to hand it to you, right? That's number one. Number two is if you are not tracking recording calls, you have to. You have to listen in. And listen, we're busy. You can't be listening in call rail all day long to calls. I get it. But you have to listen to some subset, and you have to challenge your team. I have found that most of the call centers that I work with, they love listening to their own calls.
Yeah. They'll
have team meetings now. Instead of just being yelled out or whatever, they can actually play their own calls, and they learn so much faster, right? So that was the second takeaway on that. And then the third takeaway is that you want your marketing team, your business development, your alumni team, and your admissions team, they need to be having at least a monthly meeting together. And the agency needs to be involved in that too, if they're working with an agency, because they need to hear from the admissions team what the challenges are, what type of calls. They're getting too acute client, or they're getting calls. That's how you start to solve some of these marketing challenges. Because like I said in an earlier episode, I don't necessarily want more calls. I would love to have one phone call and one admin. That's what you're shooting for, right?
Yeah.
And then I'd love to have I'd like to have one website visit that creates one phone call that creates one admin. Wouldn't that be great? Who needs these vanity metrics? That's what we're shooting for. And I think once all the teams understand that it really is about quality, transparency, that's where you start to get scale. That's where you start to get some synergies going. Right now, everything's siloed. They're fighting against each other in a lot of cases.
Yeah, and before, Jeff, you jump in, because I know you're going to have some good thoughts, but one thing you just said was about getting your agency involved in some of these calls that are around strategy. And I do see that being a missing step, in that, when we're having strategic conversations internally, the marketing team is left out of it, and somebody is responsible to translate, versus the marketing agency may be able to ask questions that maybe they haven't thought of, that could help them move the needle or save budget, or whatever it might be. But that missing step might sometimes cost programs thousands of dollars.
I've got a couple of programs, Mark, that utilize Snapshot. When you guys come on site, if that team doesn't know who you are, that's a big mistake. I want to make sure that all the teams know, if the internal team is there, they need to know them. If the agent, they need to know who the agency is. It's not that you're on the phone with them every day, but they need to know who the account manager is. They need to know who the content creators are. It cannot be in silos.
Right.
That's where when people say, well, this agency didn't work for me, a lot of times I would say it's not necessarily the agency's fault, right? It's probably on both sides, but there's a lack of communication. Because just like in recovery, right? There are certain things, well, that patient, we weren't able to help them. Well, there's probably opportunities for improvement on all sides, right? Maybe they didn't get the family involved. Maybe the patient wasn't ready. Maybe the insurance. There's lots of, but you got to bring it all together. You cannot just be so single-threaded and siloed. It will never work. Just like in recovery, if it's single-threaded, it's not going to work.
Yeah.
Yeah, if you want a microscope in how your marketing strategy is performing, I have to agree completely with Lee. The phone calls that you listen to, that's what you're generating. I mean, that is a microscope for what your marketing mix is currently delivering. Read the form fills, listen to the phone calls, and if you're not recording them, you have to. And so someone in any level of an organization should be able to listen to those phone calls, and even before we start talking about how we critique and improve the admission side, listen to that caller, because that's what your marketing plan is already generating. Okay. Are you pleased with that? Are you pleased with the caller? Are you pleased with, are we targeting the right thing? Start there. And you know what a gift that is? To actually have sort of an embodied persona right there to tell you whether your marketing is effective or not. It's just right there.
And you haven't spent $1 yet.
Correct. And you haven't spent $1.
Wow.
So I would also agree with Lee that not only do you need to come with a customized marketing plan for your program, but you start bottoms up as opposed to top down. And that's another thing that I consistently see is sort of a top-down approach to building out that marketing portfolio. And that's not really addressing who we serve, how we want to reach them, and is that the call that we want, right? Yeah. So I just think that is super instructive. Just, again, I think in addition to the weekly meetings and then the monthly meetings and getting everybody harmonized around a marketing plan, I think everyone within the organization, clinical, C-level, financial, they should listen to phone calls, because that is literally what our efforts are producing, right? And so are we satisfied with those results? And if we're not, then we can be a lot more tactical and strategic about how we shift that.
Wow, gentlemen, thank you so much for sharing your powerful insights today. This was a great episode. I know there were a ton of takeaways, so just thanks for imparting all your knowledge on everybody out there. So really appreciate it. Thank you for listening. Next week, we'll discuss how to synthesize the data and turn it into actionable decisions, as well as what quality tech stacks you should be paying attention to. So just as a sign-off as well, we put a QR code in the comments section. You can scan that to get notes and to stay in touch. But also, we've integrated into that a dashboard that can just show you some of the metrics that we capture. It's all been put together by Lee and Jeff and snapshots. So, but it's free to you all. If you can use it or your agencies can use it, that's great. We are here just to help everyone get better together. So thanks again for joining us on another great episode.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.